Globally, more than twice as many people die from cancer than from AIDS, malaria, and tuberculosis combined. Fortunately, there are many different treatment options available to help these patients, but at what cost? In tonight's special report, KETK's Kristen Chapman examines the price paid for a cancer-free life.
Well, this is a strange experience.
Meriam Eakin has been battling lymphocytosis for the last 40 years and will continue fighting the disease the rest of her life. A form of blood cancer, the treatment for this diagnosis can cost $100,000 a year.
There were 2 drip medications that were in use, and then there was a research drug.
Numerous cancer medications are created and tested annually. Fortunately for Eakin, she was a candidate for a free clinical trial.
And I took 3 pills. Some people took 6. Some people took 1 or 2, I guess, all across the country.
The drug was eventually approved by the Federal Drug Administration, but for those unaffiliated with the trial, the pills come at a cost.
We're looking at an infusion that may cost just a few $100s. But if you're looking at some of the oral medications, the ones that we have to take every day, it could be $7,000 to $10,000 a month.
Even insured patients are limited to certain treatment plans. For example, the largest insurer, Medicare, will only cover IV medications, not oral.
Oral medications may not be more expensive than some of the IV medications we get on a regular basis, but it's a bigger cost to the patient.
Dr. Donald Richards says cancer is mainly a disease of the elderly. For a city like Tyler, where a large portion of the population is over 65 years of age, hospitals see an average of 25 new patients every month.
As our patient population ages, we're going to see more and more cancer.
As the demand for affordable cancer medication increases, hospital social workers help ease the financial burden.
Some patients are on Medicare drug plans, and even with that, that's not enough assistance for some of these cancer medications that are so costly.
These staff members help patients apply for grants through drug or copay foundations, discover discounts at various pharmacies, and even sift through websites like the Patient Access Network or HealthWell for resources.
A lot of these programs are not as strict as, say, applying for Medicaid. So even if a patient doesn't think they might qualify, it's still worth the time.
Helping patients save money and their lives.
If a patient is approved, they could get so much as a $8,000 drug for free each month.
The goal is to make sure individuals never have to choose between the price of drugs and survival.
So expensive now that if I were coming into the market for this drug, I would probably consider long and hard if I wanted to, be treated.
The average insured cancer patient still pays nearly 20% of the prescribed therapy price tag, costing more than $25,000 per year. So with this type of financial burden, it's no surprise that people with cancer are nearly 3 times more likely to file for bankruptcy than those without.
In most cases, it's not like you're choosing not to get an antibiotic or an antihistamine. This usually is life or death.
This is the cost of living. Kristen Chapman, KETK News.